Hello, my name is Gabriella Boo, and I'm going to be discussing skincare and the proper way to care for our skin. Have you ever had a sunburn, suntan, sun poisoning? If so, you have experienced damage from the sun. As human beings, the largest organ of our body is the skin, and we are never too young or too old to start caring for it. Before being able to care for our skin, you should know your skin type. Do you know yours? There are 5 skin types. The first is oily. Those with oily skin have enlarged pores, their skin tends to feel oily and shiny, and they are prone to blackheads, pimples, and blemishes. Second is normal skin tones. Those with normal skin tones have good circulation, smooth even texture. They have medium-sized pores and their skin has a tendency to feel dry. However, their skin may feel oily around the T-zone area when waking up in the morning. The T-zone area is the forehead, the nose, around the eyes, upper lip, and chin. Thirdly is sensitive skin. Those with sensitive skin have thin, delicate skin. They have fine pores. They are prone to broken capillaries. They may have allergic reactions. They may flush easily, and they may be rashy. Fourthly is dry skin. Those with dry skin have a tendency to have dryness and tightness, especially after cleansing. They may have fine wrinkles due to the lack of moisture in their skin, and they are prone to flaking and red patches. Lastly is aging or sun-damaged skin. Those with this skin type have a tightness in their skin, visible wrinkles, leathery texture, broken capillaries, and they have droopiness around the jawline, the chin, and the cheeks. By knowing your skin type, you are now able to care for your skin. A good way to do that is by using the 4-step skincare regimen, which includes the first step, which is cleansing. Use a good, inexpensive cleanser. Dermatologists recommend Cetaphil Daily Facial Cleanser, which is only about $10, or Olay Foaming Face Wash, which is only about $5, which is what I use. Avoid using any bars of soap, for they dry out the skin. Cleanse once a day, which is best to do at night, to clear out all of the dirt and oils that are collected throughout the day. In the morning, just splash on some lukewarm water on the face to remove any excess dirt and oils from the skin collected overnight. Those with dry skin, it is recommended to use creamy cleansers to seal in some moisture while cleansing, and those with oily skin, it is recommended to use clear cleansers. Step 2 is exfoliate. By exfoliating, you are removing the dead layer of skin cells on your skin and rejuvenating your skin complexion. Use scrubs with tiny grains as opposed to scrubs with large grains, for they can do more harm than good. Only exfoliate once a week. Any more than that is way too much. Step 3 is moisturize. No matter what your skin type is, you should moisturize. Moisturizing seals the moisture into the skin. How much, you ask? Well, that depends on your skin type. Those with dry skin might use more moisturizer than those with oily skin. Your skin will let you know. And lastly is step 4, apply sunscreen. It is so important to use sunscreen daily, even in the winter and on cloudy days. Sunscreen prevents sun damage and should be used as early as the doctor says until forever. In fact, did you know that the UVAs are present during daylight hours all year round, 365 days a year? That's right. So before going to the beach on a hot summer day or snowboarding in the winter, you should be applying sunscreen. Although Hollywood portrays being tan as beautiful, it doesn't mean you have to do so in the sun or in the tanning beds. There are other various alternatives to getting a glowing tan. Such alternatives include spray tanning, lotions, bronzers, airbrushing, and many more. Tanning is the skin's reaction to the ultraviolet radiation, and its natural way for crying for help. The darkening of the skin is the skin's natural way of defending itself from the sun. Once enough damage is done to the skin and done to the DNA, wrinkles, sagging, spots, and/or moles begin to emerge, or even worse, skin cancer. Tanning beds are not safer than the sun. In fact, it actually increases the chances of getting skin cancer. The American Academy of Dermatology states that the average 15 to 30-minute session in a tanning bed is equivalent to one day at the beach. Statistics also show that one blistering sunburn in childhood or adolescence, or 5 sunburns total over the course of one's life, doubles a person's chances of developing cancer in their life. Melanoma is a malignant tumor that originates in the melanocytes and is the most serious form of skin cancer, causing the most fatalities. Fortunately, if recognized early enough, it is 100% curable. To check for this, it is advised to use the ABCDE test, which tests for warning signs of melanoma. That is why it is so important to become familiar with your body, any moles, freckles, birthmarks, anything that you may have on your body, and notice any changes in it, such as the following: A, asymmetry, B, border, C, color, D, diameter, or E, evolving. Henceforth, sunscreen is extremely important and vital for our lives. There is no such thing as a safe tan, and there is no substitution for sunscreen, not even a base tan. Even those with dark skin tones should use sunscreen. And don't be fooled by the waterproof sunscreens. They may be water resistant to a certain extent. However, you should be reapplying sunscreen every 2 to 3 hours, and it will say that on the manufacturers too. You should also be reapplying every 2 to 3 hours, especially if you find yourself in the water often or if you sweat a lot. What you may not know is that you can even get a sunburn in the shade. The dangerous UVA rays that cause sunburn can be reflected off water, sand, snow, and concrete. Therefore, knowing the serious dangers of the sun, you can now take proper precautions before entering in the sun, and together we can decrease those statistics. So what do you choose? Healthy skin or cancer-infected skin? Your choice determines your fate.